Hi, I'm Dr. Michael Taggart with Lake Washington Chiropractic. I'm a board-certified chiropractic physician with over 18 years clinical experience. I have advanced training in neurology, spinal rehabilitation, and metabolic and nutritional testing and treatment. I want to welcome you to our Thyroid Recovery Program DVD, where we explain how we treat our patients both neurologically and metabolically, and we explain how this is going to help you with your chronic thyroid condition. The information I'll be sharing with you is somewhat technical in nature, so I recommend that you maybe watch this DVD more than once to help you understand the concepts. Also, it would be a good idea to take some notes throughout the presentation. There's a website that I'm going to bring your attention to. It's called www.lifechangingcare.com, lifechangingcare.com, all one word. I'd like you to go to that website and click on the testimonial section and spend some time reading about the testimonials of patients who have been helped with the kind of therapy that I do and other doctors throughout the country who have been trained in a similar manner to myself. There's a section specifically on the thyroid. There's also testimonials from patients who have been helped with all kinds of chronic health conditions like fibromyalgia, chronic neck and back pain, peripheral neuropathy, migraine headaches. And so as you watch these videos, it's going to help you have some hope that if these people, many of which were told there was nothing more they can do and they would just have to suffer and be on medications for the rest of their life. So if these patients can get better, then that's going to give you some hope that you can get better too. Now, a lot of the information I'll be sharing with you today is based on this book called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And this is by a Dr. Datis Karazian. He is one of the foremost authorities in our country and probably even the world on thyroid disorders and effective treatment. I would highly recommend that you get this book. You can go online and get this book through Amazon or any type of similar type of online bookstore. If you become a patient in our office and we accept you into our program, you'll get a complimentary copy of this. You'll very much enjoy this book. Now, 99% of this information I want you to know you've never heard before. And we want to talk about why thyroid health is so important. Now, a big concept to understand is that every cell in your body has a receptor site for a thyroid hormone. So if there's a problem with thyroid metabolism, that could virtually affect any system of your body. Let's talk about some of the systems that can be affected when your thyroid metabolism is not functioning properly. Well, it can definitely affect your level of energy. If you have a low thyroid, you're going to be very lethargic and you're not going to have any energy. If you have a high thyroid, you're going to be kind of jittery and bouncing all over the place and feel like you're hyperactive. The thyroid also is important with bone metabolism. There's a hormone called calcitonin that your thyroid, in conjunction with your parathyroid, helps to balance calcium levels in your body. So if you have a chronic thyroid condition, you may end up with weak bones or osteoporosis. Low thyroid function can also affect your gastrointestinal function. If the thyroid's low, the colon, the bowels become sluggish. That's going to increase the time that it takes you to digest your food, which is going to expose you to more toxins than you should be exposed to. It's going to increase the possibility of food intolerances and also developing gut infections. Low thyroid also affects hydrochloric acid production. So if you're not digesting protein, that can also set you up for a lot of digestive issues. It also has a big effect on your hormones, both male and female hormones. If a woman has a very low thyroid, she will not be able to ovulate and won't be able to conceive. Thyroid imbalances, especially low thyroid, can also affect your detoxification mechanism, like your liver and your gallbladder. Those become sluggish. It decreases your ability to detox your body. And also, we often find that patients who have a low thyroid will often have high cholesterol and high triglycerides. When the thyroid is brought back into proper function, these blood lipid panels become normal. Now, another thing that can happen when you have a low thyroid is that you can't burn fat. So as a result of that, you don't lose weight, despite diet and exercise, and that can be very frustrating for people. It also can impair your ability to metabolize glucose. Glucose and oxygen are the fuel that your brain needs. So if you're not getting proper glucose metabolism occurring in your body, you're going to be you're going to have very poor mental function, and you're going to have brain fog. The thyroid also has a big effect on body temperature. So if you have a thyroid problem, it could contribute to hot flashes and night sweats. Also, low thyroid can also affect anemia, because if you're not digesting proteins, you're not going to be absorbing vitamin B9, which is folic acid, vitamin B12, also called cyanocobalamin, and it's also going to affect iron absorption. So this is something that thyroid problems can also cause. Thyroid problems can also cause heart problems. There's a protein breakdown product called homocysteine that your body makes. And if that level raises, it actually inhibits your thyroid. And if your thyroid is either low or high, it can cause a low pulse, a sluggish heartbeat, or if it's a high thyroid, it can cause a rapid high heartbeat and rapid pulse. Now let's talk about the current medical model for thyroid diagnosis and treatment. Unfortunately, the current medical model is based on 1960s physiology. Now this presentation that you'll see will help you understand why this approach is totally inadequate. And that's why many patients are not improving who have thyroid problems. The information I'll be presenting is based on 2010 information. Now, if you're watching this video, it's a good chance that you've had medical care, maybe several medical people that you've seen, and the fact that you're watching this means you haven't gotten better, and so you're going to have to look at a different approach if you want to recover. And this DVD is going to teach you exactly what you need to do to get your life back. Now, there are 7 different metabolic pathways in the body, so this would be something good that you'd want to start making some notes about. We'll go over each pathway. Now, here's the thing that's really surprising to people, is that only one of these pathways is really a fault of the gland itself. The rest of the problems are something else going on in the body that's affecting the thyroid gland. So let's talk about some symptoms. Actually, let's talk about thyroid metabolism so you can understand a little bit about how the gland works. So here's what happens. There's a gland in your brain called the hypothalamus. And the hypothalamus senses the level of thyroid hormone in the bloodstream. If this gets low or high, the hypothalamus is going to respond to that. If the level of thyroid hormone is low, the hypothalamus is going to send a neurological signal and a chemical signal to the pituitary gland. The chemical signal is called thyroid releasing hormone. Now, if that pituitary is functioning properly, it will respond to that stimulus, and it will also send another neurological and a chemical stimulus to the thyroid gland. This stimulus is in the form of what we call TSH. You may have heard of this, thyroid stimulating hormone. The pituitary makes it. When the pituitary makes it, it's trying to tell the thyroid gland that it's time to make more thyroid hormone. So when the stimulus occurs, the thyroid makes a protein called thyroglobulin. It combines it with an enzyme called thyroid peroxidase, and then it also combines either 3 or 4 molecules of iodine, and it makes what we call T3 and T4. Now this is very important. Once the thyroid gland makes those 2 hormones, only T3 is the active form. T3 is what creates the activity in the cells. T4 is inactive. It doesn't have any real strong physiologic function. Now, your thyroid gland, when it makes these hormones, only 7% of it is T3. So if this is the active form and only 7% is made by the thyroid, and the body relies on the rest, other tissues, converting it to T3, and if that's not converting, then we have a real problem. 93% of T4 is going to be converted in the liver to the active form of T3. Now, of that conversion in the liver, 20% is what we call reverse T3. It's not active. It doesn't have any physiological function. Now, of the component that is not converted by the liver, that will catch a ride with something called TPG, or thyroglobulin binding hormone, and that will actually go into your muscles and your nerves, and the peripheral of the tissues of the body will convert that into T3. Now, another 20% will also be converted in the gut to the active form of T3. So if we have a liver problem or a gut problem, then we're not going to get that conversion, and you can see how this would be a huge problem. Now, here's the thing that's very important to understand. If your doctor that you've been seeing for your thyroid has not thoroughly checked your liver or thoroughly checked your gut, then you have not had a proper workup, and it may be one of the reasons that you're not improving. Now, a lot of people come to my office saying, well, I've had the blood test, the doctor says they're all normal. Happens like over and over again. So there's two reasons that's happening we want to discuss them. One of the problems is the medical doctor typically is not testing enough of the markers for thyroid. So they're not finding the problem because they're just not doing enough testing. Typically medical doctors are only doing TSH testing and T4 testing. So the TSH tells us what the pituitary is trying to do, and it tells us how much T4 is made, but T4 is inactive. So if we only check T4, we cannot possibly find out how much active thyroid hormone is in the bloodstream that needs to get into the cells. So that's totally inadequate. That is just not going to work. We need to do a more comprehensive thyroid panel. We need to check not only TSH, but we need to check total T4. Total T4 is T4 that the thyroid gland makes, and in the bound form, which is going to bind with the TPG, which is going to go to the cells, and the unbound or the free. We also need to check T4 by itself. We need to check total T3, which is bound and unbound, and free T3. Free T3 is the active form that's eventually going to get into the cells. So if we haven't checked these things, we really haven't done a proper assessment. We're also going to check something called T3 uptake, which will tell us how many of these thyroid binding globulins are in the bloodstream. That's very important. And also we're going to check thyroid antibodies. If you have an immune system problem, your body can make antibodies to your own thyroid gland, and that's happening. That's a big problem, and that's something that we address in our office. You probably have never had this test, and it's something that's been greatly lacking in your metabolic workup. So let's talk about some of the symptoms that you can have when you have a thyroid disorder. And as I read these symptoms off, I want you to mentally acknowledge that, hey, this sounds like me. So if you have a low thyroid, and low thyroids are definitely more common than high thyroids, you're going to have fatigue, you're going to have weight gain in spite of exercise. I have a patient right now who has a thyroid problem, and she's been working out like crazy and dieting like crazy. She has like a personal trainer. After like 2 months of working out, she didn't lose 1 pound. How frustrating is that? And it's really because her thyroid gland has not been assessed properly. She hasn't had proper treatment. Also, you can have headaches. You wake up with a headache and it wears off during the day. You may have depression, constipation. You may feel very cold. You may be very hypersensitive to cold. You may have poor circulation, numbness in your hands and feet. You may have muscle cramps. You also may have a situation where you have a low immune function. You get sick a lot, and when you get sick, it takes you a really long time to get better. You may have require excessive amounts of sleep. You may have itchy, dry skin, dry, brittle hair. Your hair may be falling out. You may have swelling in your body, and you also may notice that the outer third of your eyebrow is becoming thin. Now, hyperthyroid symptoms, not as common, but definitely people have hyperthyroid problems too. Heart palpitations, inward trembling, increased pulse rate at rest, feeling nervous and emotional, insomnia, night sweats, difficulty gaining weight. Now, if you have a hyperthyroid, then you're going to have, that is caused by an autoimmune disease. There's two names that we give to autoimmune problems. One is Graves' disease, another one is Hashimoto's thyroiditis. And there's different tests to determine which one you have. Hashimoto's thyroiditis is a lot more common. In fact, the number one cause of thyroid disorders is the autoimmune cause. So it's not even a problem with the thyroid gland. The thyroid gland is just being attacked by the immune system, and it's because the immune system is imbalanced and it's destroying tissue that it shouldn't. We'll talk about some of the tests that we have to run to find out if you have this. Now, interesting about the immune system imbalance, or the pathway number 1, is that it can cause low symptoms of thyroid, or it can also cause high thyroid symptoms, or you may have both. So if you have both of these symptoms, you probably have Hashimoto's thyroiditis. And again, 70% of thyroid problems are going to be caused by that. So if you had a chronic problem that's not improved, there's a good chance that you're going to show with this. And the good news is that we know exactly what to do to remedy this problem. The second pathway is a pituitary gland problem. When we showed that schematic, we talked about how the pituitary stimulates the thyroid. Well, in this case, it's the pituitary gland that's at fault. It's not the thyroid. And what happens is, the reason the pituitary gland becomes sluggish is that there's some kind of stress in the body that's inhibiting the pituitary. It can often be adrenal fatigue, it could be blood sugar problem, it could be an infection or some kind of inflammation. And there'll be special tests that we'll do to find out what's causing that pituitary gland to not function the way it's supposed to. The number 3 pathway is called thyroid underconversion. So T4, which is the inactive form, is not being converted to T3. And that's going to be due to a liver problem or the gut problem like we talked about. It could also be an adrenal gland problem. Number 4 is thyroid overconversion. Too much T3 is converted and the cells get resistant to it. Now, why would that happen? Well, if you have a blood sugar imbalance, what's going to happen is that you're going to get excessive T3, and T3 is what gets you going. So if your body has too much of it, your body's going to shut down the cellular response to that because it doesn't want you to go, go into hyperdrive. So it's a safety mechanism that the body has to keep you from getting too much thyroid, and it's really because of a blood sugar problem. Now in women, this can create other complications because when you have a blood sugar problem, which is going to be typically high blood sugar, your body is going to produce too much testosterone. You should be producing more estrogen and progesterone. You won't do that. You'll produce testosterone. You'll start exhibiting male characteristics. Your shoulders may broaden. You may develop facial hair. In women, this is a syndrome called polycystic ovarian syndrome. And that can be totally handled by getting the blood sugar evaluated and under control, and also clearing out excess testosterone in the body. So this is something that we also do treat in our office, and it responds very well. The sad thing about PCOS is that if you have this, you're probably not going to be able to get pregnant because you're not making enough progesterone to, once you do conceive, to keep the fetus viable. And I've had a lot of women who have had this, and they often have miscarriages, which is very sad, but it doesn't have to happen. We know what to do to help that. The number 5 pathway is what we call increased thyroglobulin binding protein. So we talked about the liver makes these proteins, and that T3 and T4 hitch a ride on that thyroid binding globulin and deliver it to the cell. So because of excess estrogen, either through replacement hormones or through the use of birth control pill, the estrogen levels raise too high, and it causes your body to make too many of these binding globulins, and so too many of the proteins of thyroid bind to them, and then they basically can't come off, and they can't get into the cell. So that's going to create low thyroid symptoms because there's too many of these binding globulins. So in order to address that, we have to address why estrogen is high and clear excess estrogen out of the body. Number 6 is thyroid resistance. And that's caused by what we call high homocysteine levels. And homocysteine is a product that your body makes when you digest protein, and it's quite toxic. If you have proper vitamin balances in your body can denature that and it doesn't become a problem. But when you're lacking certain vitamins, especially B vitamins and some minerals, this level will become high, and what it will do is it will cause your cells to be resistant to T3, and that's going to again create low thyroid symptoms. It's also going to